So this is prepared to teach for year 1, specifically for health and social care. So just before we dive in, I'll just have a couple of introductions. So I'm Patricia Devlin and I'm a Provider Development Officer who supports providers, particularly schools across the country with the ongoing Cert, onboarding, training and CPD. And I'm also joined today by Beth Hudspeth, who was also a Provider Development Officer, and we'll have Karen Barker joining on the subject specialist in the area of health and social care. So those of you who may not have heard of NCFE before, we're an educational charity and an awarding organisation that specialises in vocational education. At post-16, this includes our study programmes and T-levels, and at 14 to 16, this is our Cert Technical Award. So it's a pleasure to have everybody here today. So the webinar will provide a brief overview of the Cert Technical Award in Health and Social Care, covering the qualification structure and assessment. We'll explore the curriculum planning and formative assessment, where you'll have the opportunity to look at your pupils' knowledge journey and create a roadmap that will help you better understand how and when to teach the indicative content, as well as develop some formative assessment activities. We'll also share a summary of all the resources and support that will be available to you and your pupils before giving you the opportunity to create some teaching and learning activities of your own that can help in the delivery and content in an active and engaging way. As a group, we'll also learn from one another and share best practice on what you currently do in the classroom. And lastly, there'll be an opportunity to ask any questions that you may have about the qualification. Just to be aware that our quality assurance team recently postponed the sessions for the Model 5 assessments, but these have been rearranged, so the dates now are on the website. I don't know, Beth, if you want to put that, if you've got that link handy to put that in.
Yeah, I've just popped that in the chat.
That's great, thank you. So I'll hand over to Beth.
Thanks, Patricia. So before we start, we're going to start with the starter activity to just do a quick poll to see how confident you're currently feeling with the delivery, assessment and quality assurance of the Cert qualification. So with 1 being no to little confidence and 10 being very confident. So I'll just launch the poll now. Just loading. So 1 being no to little confidence and 10 being very confident. So we've got 100% at 1 to 2. So hopefully, we've got some at 5 to 6. So we've got some at 1 to 2 and some at 5 to 6. So hopefully by the end of the session, we'll get your confidence levels up and we'll have you feeling more knowledgeable and confident with the delivery assessment and the quality assurance of the Cert qualification. Thanks, everyone. So the first activity we're going to do is a KWL activity. So what do you already know and what do you want to learn? And then afterwards, what did you learn? So this is within your workbook. So using your participants handbook, if you have not already completed the first 2 boxes. Hi, if you've just joined us, do you want to mute your mics just so we don't get any background noise? Brilliant, thank you. So in your workbook, if you could put what you already know about Certs and what you want to learn about Certs. So if you could put that in your workbook, and then once you sort of put in your workbook what you want to know and what you want to learn, could you post one thing in the chat of one thing you want to know and one thing you want to learn? I'll just give you a couple of minutes to write what you want to know, what you already know, and what you want to learn. And I can see the chat dots going. If you post in the chat one thing you want to know and one thing you'd like to learn. So you'd like to know about the structured delivery? Yeah, we'll be covering that in the session. You know the topics and the content, great. And learn depth of coverage needed. So Kirsty would like to learn about the delivery structure and preparation for the NEA. So that, Kirsty, is within that training link that I've posted above. And those sessions are happening over the next few weeks, and then they are again in September. And you already know the topics. Great. Just wait for the last few things to come through. Where is the link for the training? It's within this chat. I'll post it again. And that is the training, the prep to assess, that will cover all questions regarding NEA. Not a problem at all. I've reposted that. Great. Thanks, everyone.
So I'd like to start with a brief overview of the structure of the Health and Social Care technical qualification. So the guided learning hours are 135, and this includes 120 hours for delivery and 13 for the NEA and 1 hour 30 minutes for the exam. So the total qualification time is 149 hours, and this includes any homework you might set and independent learning. So the NEA and the EA has a weighting of 50%, so 50% for the NEA, 50% for the EA. The content assessed in the EA and the NEA will be sampled from across the full breadth of the qualification. So the overall qualification grades are a level 1 pass up to a distinction, and for level 2 and for a level 2 pass up to a distinction star.
So next we're going to explore curriculum planning in a little bit more detail. So what your learner journey is going to look like and why. So when considering curriculum planning, this quote really resonates with me, and I often refer to it when considering curriculum design and teaching and learning sequencing. The delivery of what you need to teach from the qual spec does not need to be, nor was it intended for it to be delivered linear. Spaced practice or distributed practice, which Dylan refers to, means spacing retrieval and recall of knowledge out over a period of time rather than cram practice, regularly revisiting prior learned materials. This is an important part of an effective planned curriculum, providing opportunity for pupils to forget and relearn, supports the transfer of knowledge to the long-term memory. So considering the content areas, let's explore for a moment a blocked approach versus an interleaving, and how spaced learning and retrieval can support the delivery of the new model Cert. So a block study, which involves studying a topic before moving on to another, may have suited previous Cert models, which featured end-of-unit assessments. However, the information isn't being transferred into the long-term memory, which needs to be the primary focus. So with the new model of Certs, such that students no longer do an end-of-unit assessment, the ability to retain and recall large pieces of information has become even more important, and the science of learning evidences that interleaving is the most effective strategy. So the example on the screen explores how content can be mapped using a blocked approach compared to an interleaved approach. So in the chat, can you let us know which approach you were planning? Were you planning to teach content area one by one, or have you explored content and made the natural links across the content areas? So were you thinking of blocked, or you thinking of interleaving and making links? So we've got we teach in blocks, but identifying links and interleaving practice of retrieval. I was thinking of doing block study, as this is the model that we have used in the past for the BTEC level 3. So interleaving refers to mixing up subject topics, or in this case of the VCERT's content areas, instead of blocking them together. This helps your pupils to make connections and leads to the benefits into the transferred learner skills. In the context of your curriculum planning and design, mapping the core content knowledge and understanding effectively, allowing that overlap and the natural holistic links alongside carefully considered space practice and well-designed retrieval tasks and testing. It's an excellent formative assessment opportunity for you as a practitioner, whilst also preparing your learners for the summative assessment of the core exam papers. We'll come back to formative assessment methods to support practice test and retrieval later in the session, but for now we're going to look at the whole learner journey and how it's woven into the curriculum planning. I'm just reading there's some more things in the chat. So whereas if we flow better using interleaving, this would also work really well. So Kirsty, you incorporate retrieval practice in all your subjects. Great, brilliant. So the process of curriculum sequencing is also about mapping out skills and knowledge and content across your school curriculum. So that's what builds on what they've learned before. Sequencing the learning properly provides a smooth progression learning journey where each small step allows the learner to be successful in a continuous way. So some extra questions for consideration, and probably the most important one of the quality assurance Ofsted perspective: how aware are you of your learners of the results of the formative assessment activities that they're completing? How aware are you of the learner journey? If we look at the slide and look at the images, we've added some areas that you might need to include when you're looking at the whole learner journey. So subject specific, English and maths and digital skills, work industry skills, communication skills, analytical evaluative skills, and other skills such as problem solving, adaptability, proactively, objectively, professionalism, and so on.
Thank you, Beth. So just looking at the content areas, so there's one unit that contains 8 content areas for health and social care. The specification includes the indicative content and the teaching guidance. So I think, Beth, are you sticking that link into the chat for the specification?
Yeah, popping that in now.
That's great. But you can see those content areas on the slide. So here's a visual of the structure of the new VCERTs, and this is what was covered in more depth in part 1 of the Prep to Teach. However, basically what you can see here is you can see those key points of the year. So year 1 is all that content delivery. Year 2 is when the NEA brief will be released. So September the 1st is when the NEA brief is released. However, you've still got this time for delivery. So if you haven't finished delivering the units, then you've still got time anyway here. But you can deliver the brief from any time from then onwards. You've got the examined assessment in May, June time. So the deadline for the NEA is the 30th of April. So it needs to be all completed, marked and marks into the portal by the 30th of April. And then like the GCSEs and other exams at this time, the results will be in this July, August. So interleaving the content areas is based on the idea of a learning journey that embeds knowledge and skills through the sequencing the curriculum. So pupils are required to combine elements of their learning and show accumulated knowledge and understanding across the qualification content. So synoptic assessment enables pupils to evidence their capabilities to integrate and apply knowledge, understanding and skills gained with the breadth and depth in context. It's therefore essential when planning for the teaching throughout the delivery that the interdependencies and links build across the content of the qualification and are highlighted and reinforced. So the teaching content does not have to be delivered in a linear way. Content areas are interdependent in knowledge, skills and concepts. So teachers can take a synoptic approach across the qualification, and this will enable pupils to apply the theories and concepts from across the qualification specification in context to the skills-based situation. So through combining content and developing holistic connections, pupils will be able to demonstrate and evidence their full knowledge and understanding of the subject area in the health and social care sector. So this slide shows a summary of the NEA tasks for the health and social care, including the marks to be awarded for each section. So the key point to note here is that when you're considering the learner journey and sequencing the curriculum, the content areas need to be continuously linked to the NEA and tasks. It's also worth considering how your learner journey also links to the external assessments as well.
So let's get our thinking hats on, and we're going to do an activity. So for this activity, I'd like you to think about how you would sequence the content and why, and we've already started to discuss it a bit in the chat. So consider if you need to teach a content area in its entirety before moving on. So which areas of the indicative content link? Are there any common themes? Can you link forward and link back? How can you embed the knowledge? How can you embed the skills? So we're going to work on the Jamboard. I'll repost the Jamboard link because I think it's been moved up the chat.
And I'll pop it on my screen as well.
We're going to work on the Jamboard and start to create a learner journey knowledge roadmap, or you can review one that you've already produced. So while you've been also considering, the content areas that you've mentioned already, that you've linked. So this is on the Jamboard, page 2. And for those of you who haven't used the Jamboard before, you use the sticky notes at the side, the post-it notes.
I'll just do an example so then you can type in it and save. If you need to delete it, you can just go delete. Or you've got the text box as well.
And I've popped the content areas in the corner so that you can see how you could link them together. So we've got already on the Jamboard, term 1, content areas 1, 2 and 6 as they all interlink. Great. So is there any other content areas that would work well together or could be delivered alongside? So we do form 5 and then 6 as they link. Brilliant. What about content area 3? How do people deliver the legislation, policies and procedures in health and social care? Do you deliver that, long and thin? Do you do it in a chunk? How do you deliver content area 3? Do you link it to each of the others? To make it maybe a bit more exciting, the legislation policies. So we've got term 2, content area 3, as they now have understanding about the health sector from term 1 and need to understand policies, and then content area 4 and content area 5. Great. We introduced it in the earlier units and they're looking at barriers and reasonable adjustments. Brilliant. Term 3, content area 8 and 7. Interlink. Let's move that so I can see it. Interlink person-centered practice working in partnership. Great. Great, I like that. Planning what it's going to look like. Right, great. Thanks, everyone. So this Jamboard is your Jamboard that you can use together after this session. It stays live, so you can refer back to it. You can keep adding to it. We've got revisit all the topics within each term to enhance knowledge and understanding. Great. Brilliant. Thanks everyone for activity 1. So within your participants handbook, you have a plan, do, review. So we're just going to pause and take an opportunity for you to take a look at your plan, do, review template. So we're going to take a few moments to consider what you've already done and what you'll need to do today, next week, and by September, linking to activity 1. So consider, you know, what we've just talked about on the Jamboard. Will you sequence in your contents like that? Will you look more interleaving? So on your workbook, page 5, for activity 1, what you've already done, what you might do today, which could be take some things off the Jamboard next week, relook at your curriculum, and then by September, have your curriculum roadmap all ready to go. So it'll just take a couple of minutes for you to complete your plan, do, review. Sarah, if you post your email in the chat, I can send out the workbook now. I think those of you registered late, did you register last minute? It might have been missed off the list that I sent out earlier. Thanks, Sarah. I'll send that over now. Right, Sarah, you should have that now. So the plan, do, reviews, just while you've got thoughts in your head, somewhere to put, you know, your ideas while we're talking through this webinar. Okay, Patricia, should we move on to activity 2?
Yeah. So for this activity, I'd like you to all think about the teaching and learning activities or tasks that can enable you to teach the content in an active way to your pupils. So we're going to be looking at the Jamboard on page 3 and using the sticky notes to record answers in the different content areas. So just some examples that you could use are things like guest speakers as a social care practitioner. So I'll put that Jamboard 3 on there now. So page 3 of the Jamboard, activity 2.
So we've got some already for health and social care provision and services, healthcare, work visit, observing different care needs. So what other ways can you deliver the content areas through active teaching? So we've got the care needs of an individual, could be a case study activity, a case study of someone on disability, and the student has to identify the condition. And then we've got for job roles, we've got role play activities. Great. Or also a whole class discussion to identify different practitioner roles. So lots of role play activities. We've got student digital presentations on the topic. That's for legislation, policies and procedures. And we've got making a career display, including information for each of the job roles, professional discussion. You add one as well, Patricia.
Yeah.
Scenarios based on procedures.
So like, what would you do type of thing? So this is the scenario. What would be your process? What would you need to do?
So what about how health and social care services are accessed? How could we actively teach that content area? Could that be also through role play, classroom discussion? And again, with partnership working in health and social care. So what's this? Role play activities and gingerbread men. They need to indicate what they do, what the day-to-day responsibilities are using pictures. Oh, I like the gingerbread man. Guest speakers from different specialisms. Great. Scenario-based activities or how health and social care services are accessed. Yeah, great. People coming in to talk about different disorders and care needs, i.e. dementia. Yeah. Brilliant, we've got loads. Great, thanks everyone. Shall we move on to our next activity? And remember, this Jamboard is there for you to access afterwards and take away these ideas from each other.
So that's the one that we've just done, isn't that? There.
Yeah.
Right.
Thanks, Patricia. So hopefully you found that activity useful and you'll be taking away some great ideas to try out in the classroom. So leading on from activity 2, we thought it would be useful to share best practice, such as a resource and or ideas that can enhance effective practice in and out of your classroom for your learners. So using the Jamboard on page 4, please let us know what resources you currently use or have within your centre. How do you use them? Is there an opportunity outside this session for you to share resources with each other? So a few examples have been included to get you started. And it can be resources from handouts to actual physical resources you have in the classroom.
I'll just put that Jamboard up now.
So Jamboard page 4, we've got some already coming in. So we've got mock exams, different type of questions, digital quizzes, differentiate questions, mock synoptic projects. So any ideas and resources that you could use or you have already. workbooks with different tasks in line with Synoptic projects tasks, health-related equipment and real-life assessment forms and documents, learner workbooks and exam revision, YouTube videos, identifying where 6Cs have been seen, so we've got question and answer sessions with health professionals. Health professionals ask questions related to the topic. Great. Where your school's based, is it quite easy to get sort of guest speakers in and health professionals, or does it have to be done by via Teams? Is it something that some schools you might struggle with, or some it's quite easy to get contacts? We've got complete mock Synoptic tasks individually, one task at a time. Reflective journal, reflecting on learning, work visits. What have they learned? What activities have undertaken? What went well? What could improve? Topic walls around the classroom, like that one. Work ideas get added to. For example, the main registration are visible in the classroom with the simple summaries. Yeah, that's great. And then I always remember when I was teaching, just having it on the wall. It's just there, isn't it, as a reminder. It also makes your classroom look interesting. Great, thanks everyone for sharing. And as I said, you can keep adding to this Jamboard. So again, let's go back to your plan, do, review and looking at the active teaching, the resources that you've shared with each other. So take a few moments. Is there anything, within those that you think you might use, that you might consider in using, by September? Is there any that you'd like to sort of start looking at by next week? So we'll just give you a couple of minutes to add to activity 2 and 3. Your plan, do, review. Is there any that you would like to take forward? I like the reflective journal. That's one that I would be wanting to use. Right, we'll move on to the next slide. So if you just keep adding to that plan, do, review and use it as a tool.
Okay, right. So there are classroom packs containing ready-to-go teaching and learning materials with everything you need to deliver the VCERT effectively. The classroom packs are digital and in editable format and are free to download. You've also got the complete schemes of work, which outline entire units based on 1-hour lessons for each content area. The schemes of work will contain additional levels of detail to help you deliver your lessons and include with suggested timings, lesson aims, learning outcomes, and suggested assessment activities. You also have the PowerPoint presentations covering each of the contents from the specification, including teaching activities that could be used with your pupils. There's also comprehensive workbooks to complement the schemes of work, which will contain classroom-based activities to recap and assess learning. The workbook will also include independent study tasks that can be used as homework or for flipped learning opportunities, whatever you decide to do with those. Furthermore, the workbooks will contain learning roundups, which will be short formative assessments for pupils to assess their knowledge using similar question types, so multiple choice questions, short answer questions, extended writing questions. So those that will be used in the external assessment. And as with all these resources, it's best to use them and adjust them to suit your pupils. needs. And as I say, these are free to download. So we're going to take a closer look at the assessment and in particular formative assessment. So let's recap back to the quote we shared previously, but explore practice testing and how this links to formative assessment and preparing your pupils for the EA and the NEA. So in the context of your curriculum planning and design, mapping the core content, knowledge and understanding effectively, allowing that overlap and naturally holistic links alongside carefully considered space, practice and well-designed retrieval tasks and testing is an excellent formative assessment opportunity for you as a practitioner, whilst also helping prepare your pupils for the summative assessment of the core exam paper. So research suggests that practice testing at regular intervals can help prepare students for exams with reduced anxiety because they're used to retrieving that knowledge on a regular basis. So it's important that there are a variety of methods for formative assessment, which is contextualized and takes place on regular basis. It's also important to have both feedback, so focus on performance, and feed forward, so focus on their development in the future. So formative assessment helps the development of wider skills, knowledge and competencies and confidence and enhances their employability skills, which links to the learner journey explored earlier. So as well as gaining knowledge, students are aware of their skills and how to develop these. So to support you in your preparation for delivery in year 10, we're going to spend the next part of the session looking at formative assessment. So I'm sure you'll all have your own effective formative assessment strategies, but the provided development team can also help support with formative assessment strategies and ideas to help you prepare your pupils for the summative assessment of the EA and NEA. So on the screen now, you can see a range of formative assessments methods. Which of these do you already use? So if you would like to post in the chat, so any that you use, any that you don't use, but you think, oh, that sounds interesting, I'd like to know more about it. If you can just pop those into the chat.
So we've got quizzes, paper and interactive. Role play scenarios based on tasks. You can see the chat dots going. I'll wait for them to come through.
I'm going to mention Plickers because I really like Plickers. So Plickers is an online interactive sort of questioning tool. So what you can do is you go onto the website, you create your questions, you put your learners' names in, and each learner gets a QR code which they can stick onto a folder or on their books. And what you can do is the start of each session, you could ask them a question. They hold up their QR code, either answer A, B, C, or D. And then it tracks the progress over time. So if you did it 1 week, you might then decide to do it in a few weeks' time. So you could do things like on health and safety. It could be, I mean, you could put questions on anything, but it's just that constant retrieval. And then you've got a record, and all you do is you scan with your phone their QR codes. They don't need any technology other than the code, and they're all free, so you can just download those and put them onto their folders.
So we've got in the chat card sorting topic tests, plenary and starter tasks like give me 3, research, role play, presentations, whiteboard questions. So does anyone else use any of the apps? Any of the interactive ones? Kahoot.
Yeah, Kahoot's good for more in depth, but if you want that quick at the beginning, you could just set a couple of questions, and they get quite competitive with the Plickers on who's got the most out of like each week or each lesson.
So you've got use Kahoot, but the schools, yeah, a lot of schools you're not allowed phones, are they? Or
With Plickers, you use yours. They don't have access. They don't need to have a phone at all. Plickers, as they have the card, you scan it on your phone. It's just one quick go round. You can do it at like a sort of 10 seconds, get them all in. And then because you've got each QR code for each pupil registered on there, it shows and gives you their response. So you can see who's getting it wrong and who's getting it right.
That sounds great.
As I say, it is free. Have a look at it if you've got it, if you get a chance, because it is very, very good. It can be used for all subjects. It's good.
And we've just got in the chat, do they respond? How do they respond though, Patricia? Don't they need their phones to respond?
No, because what they do is you get those QR codes. So they've all got their QR code. You've printed them out. You stuck them on their folder. You put the question, you've got access, so you can either type it in a website or you can do it on your phone. You set the question. They come into the classroom. You may have that question on the whiteboard and say, right, you're going to answer this. Hold your folder up, whether you think it's A, B, C, or D, and then you just get your camera on your own phone, scan them all, and there it does. Because each card is registered to each person, you get like an overall of they've got this right, they got it wrong, and it also times you to see who gets it the quickest as well. So that they don't need phones at all. It's just you using that phone, your camera, to get their QR code, and then it just registers them all on your Plickers registration. And you can have multiple classes, so you can set it up for multiple classes. You can set it up for Ofsted like it, because you can show that progress. If you ask that same question 3 weeks later or 4 weeks later, and see whether, yes, they didn't get it right there, but when we readdressed it here, we can show that they did get it right. So it's showing that progress over time.
Sounds great.
So I'll just move on to the next slide. So moving on to feedback, a powerful method that can address the majority of the assessment for learning 5 key strategies is live marking. So live marking puts a great emphasis on verbal dialogue that's scripted and targeted to help pupils improve their work. So this means that pupils can instantly act upon the feedback, all the while significantly reducing written marking for the teacher. So live marking permits the teacher to give pupils concise, regular feedback that can be acted on immediately. So I know that some of you may be governed by your marking policy and understand that Ofsted purposes progress is not evident in the situation, but has anybody come across yellow box marking? So yellow box marking can overcome this issue, as it's a more targeted approach to marking and ensures that teachers and pupils focus on specific areas of work rather than entire pieces. So it encourages the teacher's feedback to be diagnostic and support improvement. So the area of work is clearly marked, focusing on key marking points. So in 2020, a study found that pupils valued verbal feedback over written feedback, and it was stated that pupils who received verbal feedback perceived the feedback to be better in terms of quality, use, quantity, timing, and usefulness compared to pupils who received written feedback. So this can come from peer or self-feedback, and it makes the feedback instant, immediately actionable, and you get formative feedback because you'll see if there are any common errors and the need to readdress. So the final idea to consider regarding feedback is the idea of repeating content and the intervals between teaching and feedback activities. So linked to the idea of formative assessment, how do you know, but more importantly, how do your pupils know that they've retained the new knowledge and understand how to retrieve it and apply it across the subject area?
So it's now time for activity 4, where we're going to put some of the theory into practice. So we're going to share with you a number of formative assessment tasks that can be used and adapted across the qualification, which will show your learners' current level of understanding of the content. So what we're going to do is we're going to talk through each task in a little more detail over the next few slides. And then what we'll do for the final activities, we'll work together and generate ideas for these formative assessment tasks. So consider how you can adapt the tasks and what the follow and what the follow-on task could be. And these are all on the Jamboard on slides 5 to 14. So we'll talk through the tasks now.
So this one is Walkabout Bingo, which contains questions from content area 3, which is the legislation, policies and procedures in health and social care. So pupils can only ask their peer one question each. They record their answer and name, and then they move on. So the first person to have all their answers filled shouts bingo. So this task encourages the pupils to talk to one another, going beyond the typical think, pair and share, as they have to engage with different members of the class. It's very simple to create, and you can also adapt it. So that's on Jamboard page 5 and 6. So we'll look at the indicative content on that one. But you could also make an answer sheet as well for your learners once they've done that.
So this activity is expand and elaborate. So teachers can provide statements from any of the content areas and ask your learners to come up with some statements. The ones in this example are from content area 2, job roles in health and social care, and the care and values that underpin professional practice, and content area 6, how health and social care services are accessed. So having a but, because, and so allows your pupils to develop the statement in more detail, as well as develop the detail and complexity of it. So in the chat box, can you add an example of a but for care values underpin professional practice and are an integral to person-centered practice? How could your learners respond? Or you can put a because, or you can put a so. So how could your learners respond if they were having to put a but because so to care values underpin professional practice? Are integral to person-centered practice. And this also helps your learners with them long answered questions, thinking of the but because so. Or you can do a but because so for communication is a barrier to accessing health and social care services for an individual. Can you think how your learners would respond if they had to write a but? So we've got but care providers can provide information in different formats to overcome this barrier. Great. So again, by learners breaking it down into the but because so allows them to expand and elaborate on the questions. So we can explore this further on the Jamboard. Just wait for the chat to come through. One more coming through on the chat. Because legislation means that everyone has the right to access services. Great. Cute. Okay, Patricia, thinking and linking.
Right, so this one is the thinking and linking grid. So a content or section of indicative content is chosen, and all the keywords or terminology associated with it are placed within the spaces in the grid. So this is an example of content area 4, human development across the lifespan. So your pupils can then roll a dice, and then the number that's rolled identifies the first keyword. Roll the dice a second time, and the number identifies the second keyword. Your pupils will then use each of the keywords to link together using the links made in the grid. So this link can be verbal or written, so they can use it at any point in the lesson. You could use it as a starter, homework activity. They can help with revision. And these are on Jamboard's page 9 to 12.
So the last task is a misconception retrieval. So for this example, we've added some common misconceptions using Content Area 1, Health and Social Care Provisions and Services, and Content Area 5, the Care Needs of Individual, and Content Area 8, the Care Planning Cycle. So your pupils will then try and provide a correct or a better answer, and through their research will attempt to support their answer with evidence. So these are on Jamboard page 13 and 14, and we've added misconceptions from the content areas and also have some examples of correct or better answers. So now that we've gone over all the formative assessment activities that you could do with your learner, we're all going to go over it on the Jamboard and just have a play around, and feel free to start adding your ideas. And we'll spend about 10 to 15 minutes and choose which one you want to work on. It might be that we want to build a walkabout bingo together. So we'll have 10 to 15 minutes on the Jamboard playing around with all the formative assessment tools that you could use with your learners. Great, we've got some starting to come through already. I'll repost the specification in the chat just. So Kirsty said, how often would you recommend using formative assessment at the end of a content or more frequently? I think it depends on your learners, and I mean, a lot of these can be fun activities. So I would suggest, during the content area and at the end.
For me, I think I'd be trying to get some kind of recall in every session.
Yeah.
Even if it's just a question or something from a previous week. Because I think the more they do it, the more they retain. We can do things like exit tickets as well. So before you leave, tell me one thing about, and it can be a topic from a previous sort of unit. I suppose it's getting that bank of questions and things together that you can just keep using.
So we're filling out the walkabout bingo, the content area 1. Have another sort of 5 minutes. Got the thinking and linking.
So if you keep adding to these as well over time, if you all keep adding ideas, you'll get a sort of overall and hopefully completed activities.
So we've got in the chat, Kirsty's saying, yes, she does quizzes at the beginning of every lesson, but would like to introduce these from today. That's great, Kirsty. You can add that to your plan do review. And after the session, I'll send out a follow-up email that will have these in these formative assessment in a document, so you can adapt them. We've started to fill out walkabout bingo for content area 8 as well. And we've got some expand and elaborate. For content area 4. So just have another minute. But again, this is for you to all use together to refer to. Great, thanks everyone. Should we move on to resources and support? We've started to fill those bingos up quite nicely. So if we revisit your plan, do review, and if you can add for activity 4, things that you've seen that you'd like to use. Do you like the walkabout bingo? Do you like the but because so? So if you can add to your workbook, and it's on page 7. And then we'll move on to resources and support that's available to you.
Thank you. So in this last part of the session, I'd like to talk you through support that's available to you and your centres and details of further information and guidance. So our NCFE website, within the VCERT page, you'll find information about why to choose VCERT and the 14 to 16 schools brochure. That contains information about Key Stage 4 vocational education and how to learn more about our VCERT qualifications. These can also be used as option evenings in order to help learners make informed decisions about which qualifications to take and what progression opportunities and careers and prospects there are for this. You'll also find the link to each of the subject-specific pages and contains the information such as the specifications, sample assessment materials, and teaching materials. And we'll also have our parent supporter and pupil VCERT information hub, where the resources are aimed at helping parents and learners make informed decisions around VCERT, including a parent's guide, what learners think about VCERT, and subject guides. So on both pages, you can also use the get in touch function, where you can request more information on subjects you're interested in. And there's also the opportunity to tick the marketing communications box to receive updates on our qualifications events and news relevant to you via email, on the phone, or through social channels. We've integrated Qual Hub into the NCFE website, so ncfe.org.uk will be where you can go to search for all our qualifications and access the specification, assessment, teaching materials, regulations, course files, document, and much more. You can use our search search our qualification function by adding your subject area or the qualification code, or you can select VCERTs in the feature box. Always ensure that you are on the correct page by checking the qualification accreditation number or QAN. So you can see this is the page for health and social care. If you scroll down, what you'll see is you have got some brief information about the qualification, including career and performance table details. If you scroll further down, you'll see the support materials tab, where you'll find qualification specification and qualification fact sheet. In the assessment materials tab, so they've got the support there. In the assessment materials tab, which would be the next one, you can see the materials that are available for the NE and EA. And lastly, the teaching materials will also be available to download here too. If you don't have a login, it will usually be your exams officer who can set you one of those up. And you can also refer to the portal user guide and the website for further support.
There is also a VCERT playlist on our YouTube channel, and there are numerous webinars, CPD sessions, and training events which you can access on demand. And in this playlist, you can also access on-demand and technical award introduction webinar, and this webinar will also be available on the vCert playlist. So I'm just going to talk to you about the provider development team and what we provide to you. So when you register your pupils, and once you are approved to deliver this qualification, you will be contacted by the provider development team, and as part of your onboarding process. This service is tailored to the individual needs of the centre to ensure your requirements are met. So the provider development team supports staff to ensure you are prepared to teach the qualification and are clear on the requirements for the delivery and assessment of the qualification. There's regular CPD sessions throughout the year, especially around those key assessment times to make sure you're on track and feeling confident. And the provider development team also provides the following services. So tutorial videos on supporting pupils, guidance on key updates to subject content, mapping documents, monthly webinars, intervention support tools, delivery training sessions, tailored workshops, and much more. Other support that's available includes our wonderful customer support team who can help support with first line inquiries, registration queries, and bookings on the portal. You can also email vcerts@ncfe.org.uk with any questions that are especially related to the new vCert qualifications. In this last section, there's an opportunity to reflect on what you'd like to take away from today's session. You can also look at what your next steps and another opportunity to ask questions you still may have. So as we're coming to the end of the session, this is your opportunity to take a little time to reflect. So there's a few options that you can do. You can go back to your plan, do review in your workbook. You could complete your L part of your KWL activity, highlighting the few key points that you've learnt during this session. You can look back at your W. Did we cover all the bits that you wanted to learn? So you can look at those. And then also on Jamboard on page 15, we're going to work together to look at the key takeaways. What will you do next? What impact will it have? And how will this benefit impact your pupils? So if we just switch over to the Jamboard. On the final page on slide 15, so you've got your reflection in your workbook, and then we've got on the Jamboard. So what were your key takeaways? What impact will it have? What will you do next? And how will this benefit your learners? So we'll just take a couple of minutes. So we've got key takeaways, importance of interleaving active learning activities. More active teaching activities incorporated into planning next year. We've got review and rewrite schemes of work for next year. And we've got more interleave practice and active activities will lead to better engagement and outcome for students. Brilliant, great. Thanks everyone. And then again, you can keep adding to this Jamboard throughout. Thanks, Patricia. We'll go back to the main slides. So we'd also appreciate if you could complete a short evaluation to help make any future improvements and or changes to the service and how we provide, how we provide that for you. So there's a QR code on the screen, and I'll post it in the chat as well. Yes, Sarah, this Jamboard is for you to all use together, for you to use as a group, So you'll have the Jamboard to access, and also I'll send the slides that are on the Jamboard in a document format. So I've popped the QR code and the forms link for the evaluation. Thanks. So now we're also at the end of the session, we're going to go back to that confidence poll. So how confident do you feel now after the webinar? So 1 being no to little confidence and 10 being very confident. So I'll just launch that now. And hopefully you'll be feeling more confident. We've got some 9s and 10s and some 7s to 8s, so that's brilliant. So as we'd hoped, by the end of the session, you're feeling more knowledgeable and confident about the vCert qualification. Thank you. So lastly, we've allowed time at the end of the session for questions for the last sort of 5 minutes. So what we'll do is we'll stop recording, and you can either pop in the chat or you can unmute your mic and ask any questions. Or if you think of any questions afterwards, the email on the screen, provider.development@ncfe.org.uk, you can also ask questions as well. So thanks for attending, and we hope you've found it useful. And finally, on behalf of everyone here at NCFE, we wish you a successful year. So I will